Medical Dilemma.
Welcome back to Medical Dilemma. Again, I'd like to say thank you to our major sponsors, Makati Medical Center, St. Clair's Medical Center, and LifeQuest Training and Consultancy Corporation with its partner, Manila Workshops. Now, joining me for the third segment are my co-hosts, Attorney Sara Sugitan and Dr. Teresita Sanchez. Okay, welcome to the show. Of course, we still have our guest, Dr. May Season. Now, for starters, okay, maybe we can talk about, the importance of having pre-employment tests, okay, to confirm whether an applicant has diabetes or conditions leading to diabetes. What is the law on this?
Yes. Yeah, or what they call PEME. I think it's physical examination, mental examination prior to employment. It's almost mandatory, especially for those requiring physical labor, like for seafarers and other workers also, so factory workers, miners, etc. They require that kind of examination. And normally, if and we have a history of jurisprudence in this area, if the employee is found to be suffering from or diagnosed to have diabetes, it works against them, more or less. I mean,
it works against the applicants.
The applicant, yes, in terms of finding employment and getting successfully employed, because it's a pre-existing condition that will increase the risk on the part of the employer to ensure the employee, medically speaking, for example, medical in terms of medical coverage. So, it can work or it cannot work. Depende siguro sa stage na ng diabetes mo.
Is it really a law already or something to that effect that if you're diabetic, you can no longer get a job somewhere?
No, it's definitely not a law, Doctora, but it is what in contractual terms classified as a pre-existing condition that must be divulged to the employer. And
but it should not be a basis to
discriminate
not to accept that.
Yes.
Really, because as we have said, you can have hypoglycemia also. You might be overworked, especially if they do physical work, labor, really.
Labor intensive.
Yes, intensive. So you can easily bring your sugar down, and that it can be very disastrous also for a diabetic already. Is that correct?
Yes.
I see.
Usually when when the employers for pre-employment, they just ask us whether the patient is diabetic or not, and because we do not recommend whether they can be accepted or not, it's up to them whether they will accept. We just give the diagnosis, and it depends on what they need. Now, for example, if he's a seaman, and then we have to give really a good diagnosis, because sometimes they go for long months away from the country, and we have to decide whether they have to bring medicines or whether they can stand the rigors of their job. And usually we have to associate, since the complications of diabetes, as I said, are usually cardiovascular, so we have to ask them to refer also to cardiologists for checkup, and also maybe to nephrologists to check their kidneys, so that they will not have accidents or morbidities while they are away.
I see. So in other words, an employer can reject an applicant because of diabetes if it will adversely affect the performance of the job.
Yeah.
Yes, the employer has discretion in hiring and firing an employee, basta provided you undergo due process. But especially for hiring, it can be, the discretion really lies on the employer whether or not to hire somebody for a specific job. So it's also, the policy there also, aside from, of course, you anticipate expenses, etc., it's also work safety. Magiging safe ba for this particular worker to be in this kind of work environment if considering merong diabetic na. So paano kung everyone should be aware in the workplace kung may emergency procedure, kung sabi nga doktor even hypoglycemic persons, 'di ba? Kung biglang hinimatay, etc. So the work environment is an underlying consideration when it comes to the discretion of the employer in hiring employees suffering from diabetes.
But once during the workplace they discover that you have diabetes, can be, of course, I think it is not a cause for termination, right?
Definitely
But
not.
definitely the person can, of course, be allowed to go on leave until the diabetes is controlled, I think.
I suppose if there is he or she has to undergo treatment, or meron bang ganun, doktora, na prolonged periods of time na kailangan
mag-leave
i-treat
siya
yung
from work or
someone
what?
who's diabetic.
Usually, no.
Madali bang
We
i-control
only ask for leave for those who are really acute cases, or those who have comorbidities. No? Like, for example, they had a heart attack or they had a stroke. No? And so we have to stabilize the patient first. Or those who are really severely uncontrolled. No? For example, their blood sugar is skyrocketing high, so we have to control it first. But usually, once they are controlled, they can go back safely to their employment. But it is very important that the third, actually they have 3 cornerstones of treatment of diabetes. One is the diet, exercise, and the third is education. No? So all diabetics, upon diagnosis, should have diabetes education so that they will be able to deal with their illness better. No? Because if they understand their illness, then they can take care of themselves. No? And also the family should also be educated about the illness. Usually educated diabetes can better cope with their illness.
So Philippine labor law does not allow terminating an employee because of the disease.
No, it does not allow for termination based on disease.
Based on disease.
But what is usually brought before the court, the issue that's usually brought before the court in that case is the issue of compensation.
Yes.
Is the employee entitled to, for example, if he was fired because of that the disease, meron ba yung back wages? Pwede ba yung i-reinstitute sa trabaho? Or if the employee died in the course of employment, ano yung covered? So that is usually the issue brought before the labor arbiters.
So it's not whether the employer is allowed or not allowed to terminate.
Yeah,
because of
discrimination,
disease.
no, discrimination is not
security of
allowed.
tenure tayo, di ba? In most
Yes.
cases. If you have been there for so long, you're already considered,
Yes, but I would like to make it clear, for the purpose of our audience, are employers allowed to terminate an employee because of a disease?
No, it's not a ground for termination.
So absolutely not allowed.
It's not allowed.
Even the very infectious HIV/AIDS, would you classify that as infectious? You're still allowed to be continuing your work
To
as long
continue
as
to
it
work,
will not
yes.
do harm to third persons and to yourself.
There are
Mas grabe pa yun, di ba?
the just
At
causes
least
for
diabetes hindi nakakahawa.
the just causes for termination are enumerated under the labor code.
Yes.
Ano yan? For example, absenteeism,
Yes.
negligence of work, abandonment, etc. So if the performance of the employee is tantamount to abandonment, you still have, assuming that, ayun na nga, lagi na absent empleyado mo, then you still have to give him or her due process. Ipatawag mo, notice, hearing, etc. before you end the employment relation. So it's not disease is not a ground for termination.
But if it's
Okay.
so
Maybe
bad,
for hiring, they can
Yes.
put that as a condition. Can they do that?
Oh,
Yeah, for hiring.
Yes, but if the employer, the employer requires that, discloses that from the very start of the hiring process, it can be, it's a contractual relation kasi. So it depends on what would be the terms of the contract between the employer and the employee. If the employer totally negates or does not want, does really disqualifies in his or her criteria someone who's suffering from diabetes, then and discloses that during the hiring process, then I don't think the employer will be held liable for discrimination.
For hiring, yes.
Yes,
But the
yes.
moment that employee is in
inside.
already,
Ayun, that's a different
story.
process.
And develops diabetes while working.
Yeah, that's a different.
What
It might be even connected with the work.
Yes,
what if,
so-
what
you
if
can have
the disease
compensation.
is the cause of, let's say, the employee's habitual absenteeism or not performing up to standards?
Yes,
cannot be used as a ground for termination?
For termination? Okay, I've handled the case of a seafarer who developed lung cancer but not diabetes. I mean, although I'll ask Dr. later kung
Similar
na-develop ba yan.
scenario.
Yeah, so he contracted lung cancer. And that was his theory, that he contracted lung cancer on board the vessel because he was exposed
During
to
work.
fumes, etc. Yes, and the PEME revealed no history, no polyps whatsoever or ano. But then, and eventually the seafarer died. The question was of compensation. Because if it was developed during the course of the employment, then the employer should compensate the employee, or in this case, the seafarer. No? So, that case was turned over to another lawyer. Pero, of course, the opposing party, kasi it's an adversarial process, sabihin ng employer or ng insurance company nung pinagtrabahuhan ng
It's a
seafarer
pre-existing
it's pre-existing, ganyan, or it's not work-related. So that's the issue. So we have to prove that it's work-related, etc. It's a long process before we can claim compensation or before they release compensation. So that's always the issue, is it work-related?
Yeah.
And
pre-existing, there's already proof that upon admission, wala pa yon. They were
Yes.
not existing. Mga diseases niya.
during
di
the
ba?
physical exam prior to
Yes.
employment.
So, they can be
so-
strict only on that initial physical examination, something like that.
But I'd like to ask Dr. Can diabetes be developed like in a work environment, or is it possible?
Siguro kung
To
cook siya.
contract, tama ba? Contra you contract
chef.
diabetes.
You work in a restaurant
Or you're a chocolate tester.
Well, it
Wine
can. It
tester.
depends on the lifestyle also, the people you work with. Like, for example, there's a high incidence of diabetes, I think, in the call centers because of the, I think the lifestyle.
Yes,
Naku, they're-
not
I
only
think
that,
they're
the
always
nature
eating,
of
and
the work itself
it's sedentary.
leads to a very sedentary
So
lifestyle.
there is, maybe because of that, as I said, the most common predisposing factor for diabetes is being sedentary and being overweight. And if you are overweight and sedentary, then, and plus the stress of the job, being, I think that can add on to the development of diabetes.
So
Yes.
stress per se can elevate your blood pressure.
Yes, the blood sugar. Yes,
The blood sugar, sorry. Yeah.
Yeah, so
I know it's an extreme scenario. No? What if, because of the stress of the job and the other factors in the environment, you end up with a bunch of employees who are all diabetic, and that affects the performance of the company? Can I still not replace them?
You just close na lang the company. Wala pa pang
you shorten the corporate
It's
term.
unfair to the employer.
Well,
also.
actually, there is no. You really cannot prove that because maybe stress is not really quantifiable that will add up to the development of diabetes. But we always say that it is a contributory factor, as to the percentage that it adds in the development of diabetes. But if you are not obese and you are not sedentary and you don't have families, maybe chances of stress only causing diabetes is not very high.
Alam mo kasi, Sunny, ang sa standard labor contract siguro, no? Pagdating sa, yung sa performance, as I said, disease is not per se a ground for termination.
Yeah, that
So,
I agree with.
Yeah,
But what
oo.
if it's already affecting the performance of the employee, and
Pares
it
mo
is,
muna.
dragging down the performance of the
yeah.
entire
Oh,
company?
hindi pwede. I would still think that that's a breach of contract. As you said, it's unfair naman for the employer to keep on paying for the expenses of an absentee worker, especially when we have a principle of no work, no pay. So, kung dun pa lang, I mean, of course, you still have to observe due process.
Yes, of course,
If
of
the
course.
employer
I
will
agree
be
with
the
that.
one to separate the employee from work. But nevertheless, as I said, if in the contractual relations or in the terms of the contract, it says na, you have to perform, you have to go to work certain number of days a month, hours of work, etc.
right.
Has to be agreed upon. So, pero ang mahirap nga i-prove doon yung, is it work-related? Because if the disease is contracted because of the work environment, then it's the employer's burden to compensate for the employee. Normally yan, injuries. Diba, doktora sa seafarers. So, may table talaga po ng compensation for
Okay.
injuries. Pero yung katulad niyan, yung diabetes or cancer, for example, there is a burden of proof on the part of the employee.
Employer.
of the employee. Kailangan i-prove mo na
The employee.
nagkasakit ako dahil sa trabaho ko
Okay.
bago ka makaklaim ng compensation. So, baliktad yung,
Ah, so it must be the employer who must prove, and
The
not
employee.
the employee.
The employee.
The employee.
The
yes.
employee.
But we have what we call an employer's compensation.
Yes.
Right? And the moment you claim that, sometimes that's more than enough.
Yeah, there's a quit claim, waiver, etc. I think there will also be a table of values. It's not like when nakasagasa ka, tapos hindi na makatrabaho yung nasagasa mo, you have to compensate him for the lost income na for the rest of his life or something like that. Pero, for example, at work, tapos hindi nakapagtrabaho yung empleyado, and then, terminate na ng employer, then, are you entitled to back wages or separation pay? So, yun na lang yung paglalabanan, yung values of the compensation.
It can contributory negligence have anything to do with this? Can it just lessen the liability of the employer? What do you think? Supposing babaya ko, gabi-gabi, lasing nang lasing. So you don't
empleyado.
perform, the
Yes,
employee.
Oo, yeah.
And it's obvious that that lifestyle has been going on for some time.
Yeah, so,
kaya?
okay. Yun nga.
Can it help mitigate
the
liability
liability?
of
Yeah,
responsibility
I would
of
think
the
so.
employer?
Siguro kung merong
Suppose so.
health coverage, if that's covered by the, I'm not very sure about that, but depende dun sa health coverage insurance. Pero however, katulad nun, fault ng empleyado, may contributory negligence, he is not observing his lifestyle, proper lifestyle, healthy diet, etc., then it is not work-related. So, although it will mitigate whatever compensation that has to be paid by the employer, as you said, if it ultimately is not the fault of the employer, then he or she cannot be held liable. The company cannot be held liable.
But you know the trend now,
Yes.
very safe among employers, mag-hire ka ng HMO. So
yeah.
they will take
So
care of
HMO will
sila na.
absorb all the
all
medical
expenses,
expenditures.
if ever. Pwede rin, di ba?
That's a good practice.
But there's also a limit for
Yes,
for
for the
the
HMO.
coverage. But the good thing is most diabetics will be able to work normally,
Yes,
unless they develop complications, like if they develop heart attack and strokes, that will limit really their capacity to do their work. No? But on the average or in general, the diabetics are capable of doing their job.
Much like a normal.
Yes, much like a normal person.
As a matter of fact, they die from other causes,
Not
complications,
really of
not from
diabetes
diabetes
itself.
per se.
It's from of the
Diba?
complications.
Yeah. And that saying holds true, no? Nobody dies from diabetes but the complications.
Like for example, you can get blind from
Yeah.
excessive
Tsaka yung mga
diabetes.
ina-amputate. Or,
Yes.
But
But there are some conditions that acute complications, severe elevation of sugar, like patient has really no insulin anymore, and then in the body, and yet is not being given insulin, severely dehydrated. That's what we call the diabetic ketoacidosis. But it's very rare now because we recognize patient and such a thing as a hyperosmolar coma. Usually in those patients who develop strokes, then that is per se dying from diabetes, really.
Okay, well, thank you so much, everybody. It's time for us to give our parting words to our audience. Maybe we start with Attorney Sarah.
Yes, I like yung sinasabi ni Doktora, diabetes education, because you have to educate not only yourself but the people around you when it comes to diabetes. First aid procedures, symptoms, how to address it. So I think that's very important. So thank you for Medical Dilemma for giving this platform for that.
Dr. Susan, any parting words?
Yes, I'd like to thank you for inviting me. And as I said before, I think the best treatment for diabetes is really prevention. And I think the stage of prediabetes is very important. And as a whole, we should be able to recognize it so that instead of treating, we will be able to prevent it.
Thank you, Dr. Dr. Sanchez.
I cannot overstress the need for an executive checkup, or at least to be conscious of your health.
Yes.
Because sometimes it's only through that you
Definitely.
discover that you have high blood,
That's
or high
Sugar.
blood
levels.
sugar.
Okay, and so we have a much better understanding of what diabetes really is. It's not a sweet sensation, rather it's a signal for you to shape up. Thank you for watching Medical Dilemma. Tune in again next Sunday at 6 p.m. here on GNN. You can also catch us every Monday from 11 a.m. to 12 noon on this same channel. help patients and families in crisis be aware and show you care. Have an enlightened week ahead of you.
Muna tayo.
Medical Dilemma